on blockchain. I'm Frank Cervone, and I will be your presenter for this session. In this presentation, I'm going to discuss how some proposed as well as currently operational blockchain projects could be informative to future projects in libraries and information organizations. What many people are not aware of is the ongoing link between medical information management and librarianship. So before we dive into the main topic, we'll take care of a couple of things, but then I'm going to provide a bit of a background on why practice in medical information management might be of interest to librarians and information professionals, particularly as they start thinking about blockchain. So we certainly thank our founding partner, San Jose State University School of Information, for setting up this conference. In addition to my work at the University of Illinois at Chicago in the School of Public Health, I'm also a visiting faculty member at the San Jose State School of Information, and I teach courses in health informatics and social network analysis, and sometimes in research methods. So we're going to skip this, I think, so we can get on to the main presentation here. All right. So the history of medical information management dates back to at least the ancient Greeks, who would keep what we would now consider case histories on patients. While the records from other cultures are not as complete, what we do know is that this practice was revived in the 14th and 15th centuries in Europe. Actual medical practice was in no way comparable to modern medical practice, but was relatively sophisticated for its time. So, for example, medical practitioners would read the signs of disease from a patient's complexion, pulse, or body fluids, such as urine. Very similar to some of the things that happen today. What was especially interesting to us is that records of these medical interventions were kept, with some of the most comprehensive of these including name, date, complaints, medical history, diagnoses, remedies and therapies, and even payment information. So very, very similar to the types of information that we keep today in our medical practice. The thing that's a little interesting about this, though, is that astrology figured in the mix due to a focus on knowledge and observations of the natural world during this period of time. This explains why two astrologers, who are pictured here, are among the world's earliest documented medical information managers. However, skipping forward several centuries, the American Association of Medical Records Librarians was established in 1928 when it was determined that the practice of medical record information was becoming too specialized to remain a subspecialty within the American Library Association. Grace Myers, the woman pictured on the cover of the bulletin here, is generally recognized as the driving force in solidifying medical records librarianship as a profession. Over the years, the field has evolved to encompass issues beyond simple medical description. And today, the field is an integrated part of the healthcare delivery system. The profession is now known as health information management, but its roots in librarianship are clear, as is the alignment of many of its practices to modern-day librarianship. And that's going to be our jumping off point for our discussion related to blockchain today. As we know, the internet has connected us in ways that would have been unimaginable just 20 years ago. With this, expectations of connectivity and information exchange have increased as well. It's not an unreasonable idea to expect that our medical records be available as we travel both domestically and internationally. Blockchain is an implementation technology that can help facilitate this type of information exchange. Now, in previous presentations at this conference, the basics related to blockchain technology were discussed, so I'm not going to rehash that information here. While blockchain technologies have been implemented successfully in the financial sector, especially to implement cryptocurrencies, industries and disciplines are still considering how this technology can be leveraged for their own purposes. Within healthcare, the possibilities for blockchain applications are extensive. blockchain continues to move from theoretical discussions to specific applications. The concept of the distributed ledger, as Jason Griffey had mentioned in the keynote, has the potential to impact issues as diverse as pharmacology and medical device supply chains, helping to recruit patients for clinical trials, and improving security and interoperability of medical devices. And as librarians and information professionals, we can learn from these and consider how these applications might apply in the library and larger information world. Now, the use of blockchains is expected to rise quickly within the healthcare community, perhaps more quickly in this particular environment than in some others. As noted in a recent IBM study, Healthcare Rallies for Blockchain, about 16% of healthcare executives expect to implement some blockchain-enabled solution this year, 2018. These solutions are expected to rise up to 56% by the end of 2020, which is pretty fast, all things considered. If we use a conservative projection estimate, these findings can be extrapolated out to 2026, when its expected implementation of blockchain within healthcare will be above 90%. And that really is a pretty significant growth in a relatively short period of time. Now, one of the ways blockchain will likely be implemented is through FHIR, the Fast Healthcare Interoperability Resources. This is kind of like FHIR for health information, not quite, but it's probably the closest analogy I could come up with. This is an emerging standard that defines data formats and elements, along with providing publicly accessible application programming interfaces for the purpose of exchanging electronic health records. In this regard, it also could be considered somewhat similar to a normalized MARC record with predefined access interfaces. The standard was created and is managed by the Health Level 7 International Healthcare Standards Organization. Interestingly, while FHIR is copyrighted, it is licensed without restriction or royalty requirements and is seen as a mechanism to further facilitate electronic health record interchange adoption. FHIR enables the separation of EHR data elements into defined structured data types known as resources. Two of the resource types pertain to identification, subdivided into providers and patients, as well as common clinical activities. As FHIR is designed using segmented resource constructs, this facilitates the transfer of complete or only selected portions of electronic health record data, depending upon the application and environment. FHIR resources follow representational state transfer, that's REST, principles, and can be validated for structural conformance to the standard through conformance statements referred to as profiles. As you can see, there's a lot of similarity in this particular standard with many of the standards that we use in librarianship. And that's where I think one of the real potential areas of synergy are possible by learning from these medical applications. So even though there are some consistencies in how blockchains are constructed, regardless of the type of application, the specific contents of a blockchain transaction differ depending upon the application. So in the proposed healthcare environment, a blockchain would contain 5 elements. The hash, which is the hash of the resource payload. So that is, although the actual resource itself is not entered into the blockchain, its content can be verified using the transaction hash upon retrieval. The contributor signature, so the digital signature of the originating node who contributed this record, in other words. The FHIR URL, a reference to the actual resource where the record is located. The FHIR profile, so the URI of the FHIR profile to which this resource conforms, so basically the syntax or the description of what is supposed to be within the data when you go and get it, and a secure index, which is an encrypted index allowing for data discovery without leaking information about the record. I would like to talk about that a lot more, but we don't have time to do that today. But I think this is a particularly interesting concept, and we will come back to it a little bit later. But as you can see here, one of the things that's interesting about the use of blockchain in healthcare is that unlike some of the other applications of blockchain, here we're not actually putting all of the information into the blockchain itself. What we are doing is putting pointers to where the data is actually located. One of the reasons for this is that it helps enhance security. It doesn't guarantee it, of course, but it helps enhance it. So the goal then is that by using blockchain technology, health data could be collected over an individual's lifetime. The primary benefit to the patient is a complete medical record that accurately and completely details one's lifetime health history. As this data can be made available to any healthcare provider the patient is working with, care outcomes should be improved, and additionally, this data can be analyzed to help predict future health concerns. Now, obviously, given the nature of the data, security, both privacy and anonymity, are fundamental priorities. To implement a robust security model, several different approaches need to be incorporated into any blockchain that's used for this purpose. So this includes encryption. So nothing in the block is stored in plain text. This is pretty standard blockchain stuff. However, when we have public information or information that's supposed to be accessible to all nodes in the network, the information would be encrypted using a network shared key. However, sensitive information is encrypted by the originating node using a private key. This is how we could differentiate what information could be shared globally and what information can be shared just by whom the patient determines it should be shared with. Privacy-preserving keyword searches. Again, this is a really fascinating concept that we don't have enough time to get into today. But what it does is it uses encryption to facilitate data searchability and discovery. It allows an external entity to request a set of transactions from the blockchain with both the query and the transactions remaining encrypted. One can see how in other types of applications within libraries and information organizations, this would be very useful if we were able to completely protect the sequence of transactions that allows someone to search for information. The technology already exists. It doesn't even have to be implemented in blockchain. But it is kind of complicated. Then finally, as was discussed in the panel, the use of smart contracts really kind of comes into play because the security for the patient record is more complex than just simply encrypting data. For example, patients may authorize access to their record only under certain conditions or for a certain reason. So coding these usage agreements can be accomplished through smart contracts. And this helps then ensure that patient authorizations are codified and executable. By putting the contracts directly into the blockchain, validity of access can be assured and audited. A critical factor in all this is that the patient is in control over who has access to their data. Obviously, in libraries, a critical factor would be that the patron has control over who has access to their data. So the patient can control access at varying levels, from full access to all of their health records to just a limited subset of the information based on the application. For example, a patient visiting the dentist can restrict their health data to just those aspects that are relevant for dentistry. Similarly, patients participating in research, such as a drug trial, could limit the amount of data that is made available both to researchers as well as what personal information of theirs the researchers can in turn share as a result of their research. So some key enabling features of all of this is the concept, again, as Jason discussed earlier, of decentralized management. And in particular, in this case, the concept that patients manage their own healthcare records. In addition, there is an immutable audit trail. So the patient records are unalterable. The data that's stored in the private blockchain guarantees the medical data cannot be changed by anyone, including physicians and patients, internally And it does this internally and natively, so there's nothing else that needs to be added to it. This is really critical in ensuring that the audit of the data and that the integrity of the data is kept throughout the entire sequence of transactions. One can see how if there were issues related to the provision of care, it would be important to be able to go back and understand exactly what happened. Another enabling feature is data provenance. So with this scheme, we have source verifiable medical records. The records are signed by the source, and it allows the legitimacy of the records to be verified, as well as false records to be plausibly denied. Robustness and availability. In addition to the decentralized nature of the system, this also reduces the risk of patient record keeping. Because data is stored, there is no single institution that can be robbed or hacked to obtain a large number of patient records. And then finally, security and privacy, because with increased safety of medical records, because the data is encrypted in the blockchain and can only be decrypted with the patient's or the provider's private key. Even if the network is infiltrated by a malicious party, there is no practical way to read the patient data. So an ultimate goal, and one of the ideas that is tossed around, is that eventually a common database of patient information could be built with the help of blockchain technology. This would include all healthcare information for everyone, which would be easily accessible by doctors and providers through any medical device. The goal is to allow the medical professional to spend more time on providing patient care, as well as enable improved care through the provision of comprehensive information. However, unlike libraries, the current model of healthcare, at least in the United States, does not really encourage collaboration, so realizing the benefits of a common system will undoubtedly be years off. So as we switch gears into what is actually being done today, we're going to talk about some applications, both in development and production, that provide some interesting insights and potential applications in library and information science. So the first project is definitely something we should be keeping our eye on. These three healthcare companies, Optum, Quest Diagnostics, and Humana, are developing a pilot to use blockchain's ability to secure and distribute health plan provider directories. That is, provide a mega directory of healthcare professionals within specific healthcare systems. The problem that they're trying to solve is related to when a claim comes through a provider, but it doesn't match the information an insurance company has in its provider directory. Health plans with out-of-date information cause patient claims to be delayed or unpaid, and administrative backlog for providers and their staff. This is a good example of an application that is trying to address the multiple sources of truth problem through reconciliation between those sources. When we look at the project between GEM and the Center for Disease Control related to decentralized healthcare reporting, this is a proof of concept right now, and the goal is to develop a decentralized data reporting service for health. So such a tool could significantly improve the ability of the CDC to monitor public health during times of crisis, and it would aid in efforts to address ongoing public health issues. Currently, public health data comes from many different sources, and there can be multiple intermediaries in the process, so city, county, state agencies. With so many disparate systems and agencies, data integrity can suffer as it moves across the supply chain. With this proof of concept, the idea is to capture data in the field and validate it quickly with a complete audit trail. This would help the data become actionable very quickly by both the CDC and other organizations. One can see here that in the publishing environment, that this idea of having a single data trail and path could be very useful as well. So turning to IBM Watson Health and another project with the CDC, they are working to develop a pilot of a secure, scalable exchange of health information using blockchain technology. Now what this differs a little bit from the last project because this pilot is focused on the exchange of owner, that is patient-mediated data, with the goal of giving patients the opportunity to share their data securely for research purposes or across their healthcare providers. One of the hoped-for outcomes of this project, in addition to new biomedical discoveries, is to use artificial intelligence to analyze data and potentially extract new insights from it. And again, this is a project that could be closely aligned with our various projects that we have in library and information science. But perhaps one of the most interesting is a current in-production implementation based on blockchain, which is a project of the government of Estonia to create a framework to validate patient identities. Partnering with GuardTime, a Dutch blockchain technology company, all citizens have been issued a smart card which links their EHR data with a blockchain-provided identity. Any update in the EHR is registered in the blockchain, and the EHR, the electronic health record, contains an immutable audit trail. So the timestamp data logs also archive the state of information from other healthcare databases. So for example, appointment scheduling is assigned a timestamp and is cryptographically signed. In light of recent concerns about scheduling fraud, for instance at the Veterans Administration, and the risk for data manipulation of implantable medical devices, such as pacemakers, such a system has several potential benefits to guarantee that any modifications to the record are secure and auditable. Then, if we look at patient data sharing, again, this is an live application right now between the MIT Media Lab and Beth Israel Deaconess Medical Center. And the implementation provides a decentralized platform for managing permissions, authorization, and data share between healthcare systems. And in this application, the patient has the ability to decide who can access their data across the various healthcare systems. These permissions create a more automated approach to data sharing for clinical and research use. And then, finally, a project from Rain Live Oak Technology related to health data provenance. And this is a particularly interesting application because it is a toolkit that's being developed to support the creation and validation of provenance records. While it's focused on health technology, this application could be used really in any type of setting where there is a concern related to provenance. The toolkit acts as an interface between user-facing services and the storage layer of the system, and this modularity enables health information systems to integrate provenance with minimal development and investment. This is critical because it really provides the potential to make provenance more reliable and accessible in a distributed environment. As we wrap up, some of the things that we need to think about, though, are some of the potential inhibitors. So, for example, cost effectiveness and scalability. It's pretty well known at this point that the computational cost of existing blockchain approaches is not sustainable for large-scale databases. However, this problem is being actively worked on. In some of the examples previously cited, using pointers to secure and encrypt sources of data rather than encrypting all the data directly is an alternative method for addressing the resource consumption issue. And so I think that that's something that we will see more frequently in the future, both in terms of health information as well as others. Scalability is closely related to cost effectiveness. So the size of a mining network directly influences the cost effectiveness of the overall operation. Alternative models for constructing mining networks are also being actively pursued, as the cost effectiveness of existing platforms that hold significantly larger volumes of data has yet to be proven in production environments. Cyber attacks are another source of concern because one of the potential drawbacks of a small network is demonstrated by a recent case where a gold-based cryptocurrency was able to be hacked by compromising the majority of the mining sources within a relatively small network. This is by just taking over 51% of the machines, the entire enterprise was compromised by bad actors committed to synchronized forgery in effect. So this is something that we have to consider as well when we implement our blockchain networks, is what sort of level of scalability we have. And another issue to consider as we look at this for libraries and in the information professions is this idea of irreversibility and how it might be somewhat problematic in our environments. This is where some of the interesting aspects of blockchain in application to libraries and information organizations will play out. Some of the basic architectural features of blockchain, such as the immutability of these transaction logs, are of benefit to libraries in the context of demonstrating provenance, but pose issues where data needs to be forgotten, such as circulation records. Provider directories, health exchanges, and the validation of identity systems could be examples for any number of initiatives to share common patron data, allowing for greater access across systems. Health data reporting could be the basis for a common reporting system that could be used to gather data for advocacy and efficacy initiatives. And patient sharing systems could be an example for providing patrons the control over who, how, and when their data is shared. So as we can see, there is a lot we can learn from applications in other industries. A big question, and one that I don't have an answer for, is how do we organize to take advantage of these for the benefits of libraries and information organizations. So with that, we are like almost out of time, but I thank you for choosing to come to this session and listening to this talk. We do have a couple of minutes, I suppose, for questions if there are any. And if not, I thank you very much, and we will see you in the remainder of the sessions today.
Frank, it looks like we have a few people typing in some questions.
Okay.
For those attending, I have also pasted in the chat window instructions on saving the slides if you are interested in doing so.
Well, thank you, Sue, and thank you, Sridevi. I appreciate it. Adrian as well. Thank you. Okay, well, we're right at 4 o'clock. Thank you, Angela. Or actually, no, 2 o'clock.
All right, I will go ahead and stop. I'm on the East Coast, so I understand. I will go ahead and stop the recording. Thank you very much, Frank.
Thank you.